Hello guys. So now we shall be discussing regarding the seventh pair of cranial nerve, which is also called as your facial nerve. Okay. So we'll discuss about your seventh pair of cranial nerve, right? So that is your facial nerve. That is also called as your facial nerve. Now within the seventh pair of cranial nerve, first of all you need to know these three important things. See, this one is called as your midbrain. Below that, this is called as your pons, and this is called as your medulla oblongata. Okay, let me write it in the short form. So this one is called as your midbrain. This is called as your pons. This is called as your medulla oblongata, and this one over here is called as your spinal cord. Now, within the pons, you have got a red color nucleus and a green color nucleus. Okay. So this particular green color nucleus which you can see over here is called as superior salivatory nucleus. What is this? This is called as superior salivatory nucleus. Superior salivatory nucleus. Okay, so this green color one over here is called as your superior salivatory nucleus. Next, this red color nucleus, whatever you can see, this red color nucleus over here is called as a motor nucleus of your facial nerve. This is called as your motor nucleus of facial nerve. Motor nucleus of facial nerve. Okay. Now, I am going to draw one more nucleus over here if you can see. See, behind this motor nucleus of facial nerve, there is another black nucleus over here, you see. This nucleus over here is called as your abducent nerve nucleus. Okay, what is this nucleus called? This nucleus is called as your abducent nerve nucleus. Now, what I am telling you is that from this particular nucleus over here, let us say that from this particular motor nucleus of the facial nerve, what is happening? A nerve that is coming out, this nerve is called as your facial nerve. Now, this nerve will turn over what? It is turning over your abducent nerve nucleus, and then it is coming down from the pontomedullary junction. You know, the junction between pons and medulla is called pontomedullary junction. So, this facial nerve nucleus is arising from the facial nerve is arising from the motor nucleus of the facial nerve. It is taking a turn and then coming down out of your pontomedullary junction. Okay. Now, as it is making a turn on the posterior side of the pons, it is creating a bumpy elevation like this. You see, there is a dent or there is a bump that is elevated. Let me draw that thing over here clearly. So, let us say this is your pons. Let us say this is your pons. Okay. What did I tell you? Here there is a nucleus. And here there is your what nucleus? This is your facial nerve nucleus. Now, from the facial nerve nucleus, the facial nerve will come and it will cross, it is completely looping behind the abducent nerve. Now, as this crossover is happening, right, as this crossing is happening exactly at this part where the facial nerve is bending, right. So, exactly at the region of the bend, what is happening? There is a swelling that is created over here. Okay, so this particular swelling which you can see over here is called as facial colliculus. This particular swelling over here is called as facial colliculus. Okay, so what is this colliculus over here which I am drawing with the blue like this? This is called as your facial colliculus. Now, what is this green color nucleus called as? This green color nucleus is called as your superior salivatory nucleus. Okay, superior salivatory nucleus. Now, this green color nucleus is superior salivatory nucleus. From this superior salivatory nucleus also the fibers are coming out like this. Okay, from here also the fibers are coming out. So, from where are they coming out? Again the same, the pontomedullary junction. Okay. Now, this red color fiber that is called as your facial nerve, this red color fiber will go up. See, it is going up all the way and it is entering into a specific canal. Okay. So, this canal which you can see, it is entering into specific canal. So, this canal which you can see is called as a facial canal. You see a canal in the form of a snake, this is called as facial canal. Actually, this is how the facial canal looks. See. This is how the facial canal is looking, right. So, within this facial canal, tell me what are the different parts, right. See, This part of the facial canal which you can see, this part of the facial canal which you can see is called as labyrinthine segment. This is called as labyrinthine segment of the facial nerve. This is called as labyrinthine segment. Next, this part of the facial canal which you can see is called as the tympanic segment. This is called as the tympanic segment. One is labyrinthine segment, another one is tympanic segment. And this part of the facial canal which you can see is called as the mastoid segment. So, how many segments of the facial canal we have got? We have got 3 segments. So, this segment is called as the labyrinthine segment, the next one is called as the tympanic segment, and the third one is called as the mastoid segment. So, right now what is happening? From the motor nucleus of the facial nerve, the facial nerve is coming out, right? It is entering into your which segment? Labyrinthine segment of the facial nerve. Now, once it enters into the labyrinthine segment of the facial nerve, then it is bending again. Now here, remember one thing, where in which places the facial nerve is bent. If you can very closely observe here, see, facial nerve is bent over here, right? This is called as the first bending of facial nerve, and facial nerve is also bent over here also. There are 2 bendings. Now, don't think this as a bending. This is the error in the picture which I have drawn here, but actually it is straight. So, there are 2 bends which you can see here. Now, this particular bend is inside the brain, right, which means it is inside the pons, inside the central nervous system. So, this bending you call it as the internal gyno, okay. And in the same way, you see bending here within the facial canal, this bending is called as external gyno. So, what are these 2 bendings over here? Just look at these bendings. See, this particular bending over here is called as external gyno, okay. This particular bending over here is called as internal gyno. Internal gyno. Bending of what? Bending of the facial nerve, okay. This particular bending of the facial nerve is called as your internal gyno. So, one is internal gyno, another one is external gyno, done. Now, what is happening over here? After this facial nerve is coming all the way and it is right now entering into the tympanic segment. Second segment is tympanic segment, and then it is coming down all the way and entering into mastoid segment, and finally it is coming out of this opening. You see this opening over here? This opening is called as stylomastoid foramen. So, your facial nerve enters through your facial canal and it is coming out of which foramen? This foramen over here is called as stylomastoid foramen. This is called as stylomastoid foramen. And second important thing, you see this box whatever I have drawn here, you know this is a middle ear cavity, right? In the center of the middle ear cavity, you have got 3 bones, malleus, incus and stapes, right? So, let us say here I am drawing one muscle, okay. Here I am drawing one muscle in the form of an S shape, okay. This S shaped muscle whatever you can see is called as stapes, okay. This S shaped muscle is called stapes. Now, what I am telling you is that this facial nerve gives a branch that supplies to the stapes. So, this muscle here is called as stapedial muscle. The muscle here is called as stapedial muscle, and the nerve that is supplying to the stapedial muscle is called as stapedial nerve, okay. So, this S whatever I have drawn over here, S stands for stapedius muscle, stapedius muscle. So, to stapedius muscle we have got a nerve from the facial nerve. Facial nerve gives a branch called as stapedial nerve or nerve to stapedius. Stapedial nerve, and this stapedial nerve supplies your innervature stapedius muscle, right. Next important thing you need to know is that this particular facial nerve where the gyno is present, which gyno? External gyno. Exactly at this place it is going to give you a branch, okay. You know what is this branch? This branch is nothing but these are the parasympathetic fibers, okay. What fibers are this? These are the parasympathetic fibers. I am just writing it as PSF. PSF means parasympathetic fibers. Now, this particular, what is the name of this parasympathetic? You are telling it is parasympathetic, fine. But what is the name of this parasympathetic fiber? This is called as greater petrosal nerve. This is called as greater petrosal nerve. This parasympathetic fiber is called as greater petrosal nerve. And this particular foramen which you can see over here is called as greater petrosal foramen. This is called as greater petrosal foramen. So, there are two important things, greater petrosal nerve and greater petrosal foramen. Now, you tell me, if I am telling greater petrosal nerve and this is greater petrosal foramen, don't you think this greater petrosal nerve will pass through this particular foramen? Right? So, this particular nerve is passing through this foramen. Greater petrosal nerve is passing through this foramen. And once after it passes through this foramen, let me correct this picture little bit for saving the space. Right. So, this nerve, once it passes through the foramen, it comes out of this foramen. Okay. After it is coming out of the foramen, you see it is entering into a canal. You see it is entering into a canal. This canal where it is entering inside is called as pterygoid canal. You see this particular canal over here is called as your pterygoid canal. This is called as your pterygoid canal. Next important thing is that pterygoid canal is opening into a fossa, right? So, this fossa over here is called as pterygopalatine fossa. What is this fossa? This fossa over here is called as pterygopalatine fossa. This yellow color shade is called pterygopalatine fossa. Within this pterygopalatine fossa, you have got a ganglion. This ganglion is called as a pterygopalatine ganglion. I will write down these things. Okay. So, what is the fossa name? Pterygopalatine fossa, and ganglion is called as pterygopalatine ganglion. Now, what is happening over here? Within this pterygoid canal right now, there are parasympathetic fibers. What is the name of this parasympathetic fiber? That is your greater petrosal nerve. So, what is happening? This fiber will enter into your pterygopalatine ganglion, and from here what fibers will start? The post-sympathetic fibers will start, and these post-sympathetic fibers, they will enter inside the eye. Clear till here, right? So, just leave this part aside. Let me come to another important thing. What is another important thing is that here you have got an artery. Here you have got an artery. This artery over here is called as your internal carotid artery. Okay, this is your internal carotid artery. Now what I am telling you is that, there is a nerve that is completely winding your internal carotid artery like this. It is completely surrounding your internal carotid artery in this way. Okay, and this nerve, look at this nerve carefully, and this nerve is entering into your pterygoid canal along with the greater petrosal nerve. Okay, and this nerve is entering into your pterygopalatine fossa, right? Let me zoom it. It is entering into your pterygopalatine fossa, and then it is also entering into your pterygopalatine ganglion, but it is not relaying on any other neuron. Okay, rather it is directly passing through this pterygopalatine ganglion and then directly entering into your orbit. Clear? Right. So, these two nerves within the pterygoid canal, together you call them as VDN nerve. You see, these two nerves which are present in the pterygopalatine fossa, right, pterygopalatine canal or the pterygoid canal, this is called as your VDN nerve. This nerve is called as your VDN nerve. Okay, and remember one thing, what is this branch which you have sent inside? These are the branches called as sympathetic fibers. These sympathetic fibers are surrounding your internal carotid artery and they are directly entering into your pterygoid canal. From there, they are directly entering into your pterygopalatine fossa. Within the pterygopalatine fossa, they cross the pterygopalatine ganglion and enter into your orbit. Okay, so these fibers over here are called as SF. SF in the sense sympathetic fibers. PSF in the sense parasympathetic fibers over here. Okay. So, these parasympathetic fibers and the sympathetic fibers, the postganglionic parasympathetic, why am I calling it as postganglionic parasympathetic? See, this is parasympathetic, the red one, but the pink one is called as a postganglionic, it is after the ganglion, right? So, postganglionic parasympathetic fibers along with the sympathetic fibers, together, these both together, they give innervation to few important glands. For example, they give innervation to a lacrimal gland. innervation to your lacrimal gland. They give innervation to your nasal gland. They give innervation to your palatine gland. They give innervation to pharyngeal gland. Pharyngeal gland. So these are the glands to where they give the innervation. Okay. So once again guys, what are the things we have discussed? We discussed something called as the, what did we discuss? We discussed here there are few different types of nuclei, right? What are these few important type of nuclei? See, this red color nucleus is called as the motor nucleus of the facial nerve. Next, this green one is called as the superior salivatory nucleus. Next, this is black one is called as the abducent nerve nucleus. The fibers from the motor nucleus of the facial nerve, they arise and they make a turn around this abducent nerve nucleus. As they are making a turn, they are creating a dent or a swelling like thing, and this particular swelling is not called as internal ginu. This swelling is called as colliculus, superior colliculus. Okay, this swelling is called as facial colliculus, not superior. This is called as facial colliculus. Next, there is a bend of facial nerve. This bend of facial nerve here is called as internal ginu, and this facial nerve bend is also present within the facial canal, that is called as external ginu. Facial canal is of different types. So the first one is called as this one is called as a labyrinthine segment. So this is called as your external ginu, and within this external ginu, the fiber is coming down. You see, the facial nerve is coming down all the way, and it is exiting out through the stylomastoid foramen. Here I told you this thing that it is giving out a branch. This is called as nerve to stapedius muscle. Nerve to your stapedius muscle. Okay, and it is giving one more branch over here, and this is called as your parasympathetic fiber. Okay, this parasympathetic fiber, which is also called as a greater petrosal nerve, is entering through a foramen called as greater petrosal foramen, and it is coming out and entering through your pterygoid canal. Right, within the pterygoid canal you have got two nerves, the red and the green. The red one is called as your greater petrosal nerve, and the green one is called as a sympathetic fiber. Together you call it as a VDN nerve. Right, and this is how it supplies to different glands. Okay, so this is all you need to know regarding the facial nerve guys. So thank you so much for watching my video. Goodbye.